follow the 5 golden rules, please go to our website and you can have a look at those golden rules, as well as how to make a mask if you don't have one. But I would like to welcome every one of you to our scenario planning and health systems response press briefing. Thank you very much for being here. There are many people who are not just journalists who are watching today, and I welcome them via our Facebook Live. I also want to say that I've received many questions on how our health department is responding to COVID-19, and I think that's what we have been preparing for, and that is what we are going to showcase to you today, giving our provincial scenarios. I have received many questions, and this is going to showcase where we are as a department, and with me today I have some professionals, as well as my colleague, Minister Norman French-Mbombo. And here is our promise. We are giving you the best available data that we have to hand right now, and we will continue to update you with that data. This is how we are going to be able to fight COVID-19, and we need everybody to play their part to ensure that our health services are not overwhelmed. We have been doing this as a country and as a region, and we've been doing this in lockdown, and we've been doing this to create that space so that we can be prepared, we can give our health systems and department the space to prepare. And I know that in addition to this, we also have to build trust, and that trust is earned. And we will continue to earn your trust by being transparent and by quickly changing in this unpredictable environment of COVID-19. As I said to you, I'm joined today by some experts. We've got Dr. Keith Kluti, and of course it's also about social distancing. I think a normal press conference, we would have all been sitting up here in a row. Those days have moved on. So Dr. Keith Kluti, who's the head of department of our department in the province. I've got Professor Andrew Bull. He's over here. He's from the Centre of Infectious Diseases and Epidemiology and Research at UCT, at the School of Public Health and Family Medicine. As well as I said, I've got Minister Dr. Norman French-Mbombo, who's our minister here in the province. And we are really lucky to have so many smart people in our province working day and night to make sure that we are ready for this curve. We are ready for this COVID-19 avalanche as it comes towards us, and that we are as best prepared as we can. And I think I must say that I was also very impressed by Professor Karim, and he was also honest with us, telling us as South Africa, this is what we've got facing, or this is what we are facing, and he shared the data and information with us. And of course, we take that research and that information, and we link with our own specialists and professionals and our own learnings in our own department, and we start to build what we are terming, or what we are going to be showcasing for you here today. As mentioned, we are preparing our health response based on the very best evidence available to us that we have seen both abroad as well as in South Africa, and our learnings here in the province, and along with the Department of Health at a national level, as well as the presidency. I must say that our response also changes day to day based on people's behavior. And this is where each and every one of you have to play your role in making sure that we are going to be able to get through this. We have to get through this together. Every one of us has to play our part alongside the health response. There is another point that I would like to stress, and it was made by Professor Abdul Karim, and he stated that lockdown has served to delay the peak in COVID-19 cases. It cannot prevent it. So it slows it down, but it can't prevent it, and it gives us that opportunity. this has allowed us the time to build the systems that we are showing you today. Lifting lockdown in whatever form it takes will not make this problem go away. We cannot just go back to normal. And we are going to hopefully hear from the President tonight about some of the processes going forward, but we have to adopt what I call the new normal in the way that we behave in order to continually flatten the curve and save lives. As the Western Cape Government, we have done our best to use this lockdown period to prepare our capability for major increases in COVID-19, and this is and what we expect still to come. Our own response backed by Google's mobility reports show that the Western Cape residents have, by and large, come to the party, and that we have obeyed the lockdown rules and managed to flatten this curve. And I really want to thank the citizens of our province. Has anybody got some water? That would help. Thank you. Can I also say that we need to all do this even more so going forward to reduce the peak of infections and prevent our health system from becoming overwhelmed. That is what we've got to do day and night, making sure that our health system and what we are adding to it is able to compete or to deal with what is coming at us in COVID-19. Our scenario planning reveals the following. We expect about 80,000 to be infected and symptomatic at the peak, and more than 90,000 thereof to recover at home. We expect 80,000 infections to be infected, or people to be infected and symptomatic at the peak, and more than 90% thereof to recover at home. And I think that's very important, bearing in mind we always say when you show symptoms, stay at home, phone our call centres before you go to our hospitals. We also anticipate that a shortfall of 1,000 beds in acute and 750 beds in critical care facilities, respectively. I'll say that again. 1,000 beds in acute and 750 beds in critical care facilities, respectively. And we are planning field hospitals to account for those needs for acute beds. But we will have a shortfall in critical care beds, which is driven by a shortfall in critical care nurses. And we'll explain that as we go through the presentation. It's going to be tough, and we all have a good idea of what this peak is going to be, and we are preparing to be able to respond to this case. I have teams working around the clock to prepare, which our presentation will show now today. At the front line of our war with COVID-19 are the healthcare workers. And we have, of our healthcare workers, 14,000 healthcare workers, and so far, 47 of those healthcare workers have shown COVID or have been produced as COVID-19 or COVID-19 positive. And our healthcare workers in the province have to be protected at all costs. We have to make sure that we prioritize them with giving them flu vaccines, and we have to make sure that we give them the adequate PPE that they need for this response. We currently have 44 million rands worth of PPE on stock, and we have 100. Oh, that's perfect. Thank you very much. Thank you. That's much better. We currently have 44 million rands worth of PPE in stock, and we have 185 million rands worth of PPE on back order. And of course, this is exactly what we need to be doing to making sure that our front line staff are prepared for when this curve when this curve hits us. We are also working with companies to upscale local production, giving businesses and local South African entrepreneurs an opportunity at the same time. Innovators are coming to the fore, and we thank them very much for that. We will continue with our recruitment drive for healthcare volunteers, and I thank those that have come forward already. We have already more than 1,000 healthcare volunteers who have come through our website, and anybody else who would like to make themselves available, we ask them to contact us, and we will call on them when the need arises. We have a public healthcare capacity of 3,000 tests per day, and we are going to have 4,000 at the end of the month using the new Gene Expert tests. I know that we are worried about ourselves, our families, and our future, and we need common resolve as a province and a country so that we can flatten the curve. We have achieved so much as a nation, and I know we can do it again. I am worried about also the stigma that we see with regard to COVID-19. We need to show kindness and compassion when anybody contracts coronavirus. We need to make sure that we give them that compassion as they go through this process. There will be people who need to be isolated at a facility because they are not able to stay at home, and we should welcome them back warmly once they have recovered from this virus. Finally, our commitment to transparency. We are making our case data live on westerncape.gov.co.za, our website, and this dedicated dashboard, which will be up at the end of the week, you will be able to track and follow every single thing that is happening in our province. All the data will be there. This is not a once-off exercise, and we will be taking this forward as it changes day by day. And I promise you that I will keep you updated every single step of the way. I would like to then ask that we go into the presentation. And first of all, I would like to ask our Head of Department of Health, Dr. Keith, to come forward.
Thank you very much, Premier. Thank you very much, Premier, and good afternoon to everyone. My presentation will focus on the following three things, and I'll be sharing it with Professor Bull. It is the current status of the COVID epidemic in the Western Cape, the predictions for the future of the epidemic, and the likely resource requirements that the Premier spoke about. And then lastly, our Western Cape strategy underpinning our response to COVID-19. The global and the national context. There's lots of information available on COVID-19 globally, including the WHO website and many dashboards. The National Minister and the Chair of the Ministerial Advisory Committee, Professor Abdul Karim, briefed the nation a week ago. There are daily updates. The President is probably considering all the evidence and will announce on the post-30 April lockdown arrangements, in all likelihood in a phased lifting of lockdown, but many controls still remaining in place. The prevention measures such as the cough etiquette, social distancing, hand hygiene, and the use of masks must be deepened with a special focus on high-risk areas and also focused on vulnerable groups. We keep abreast of all of these developments as we do our response to COVID. So firstly, drawing from Professor Karim, we just want to explain to you on the left bottom draw. When Professor Karim made his speech, he said globally in South Africa, the blue epidemic is the imported cases. The red epidemic was the cases associated with the imported cases. And the green one was community transmission. Our experience on the left upper side in the Western Cape is community transmission has taken off in the Western Cape. That's borne out.
All right, we're going to come out of that update from the Western Cape for the time being. Hopefully we'll come back to that